Well, thank you guys for coming. My name is Kersh Cooks, and I will be presenting today Senior LinkAge Line, who we are and what we do. I am currently from the community outreach team. I have actually been with Senior LinkAge Line for a little over 3 years. I started on the phones as a long-term care options counselor, talking with a lot of individuals about different options and resources, Medicare counseling as well. I was with the phones for about 2.5 of those years, and then I transitioned into outreach where I get to talk to you guys. This is basically what we're going to cover, giving you the highlights of Metropolitan Area Agency on Aging, what is Senior LinkAge Line, and the resources that are available through Senior LinkAge Line, and how do we help, long-term care options counseling, Medicare counseling, resources for caregivers. The Aging Network is kind of over all the aging agencies. It just makes sure to see how everyone is operating. And then you have the Administration for Community Living, where they actually also oversee, and it's through the Department of Human Resources, Department of Health and Human Services, excuse me. They are operating through the distributive funds. They distribute the funds through the Older Americans Act, and those funds, for us, it goes through Minnesota Board on Aging, and they fund Metropolitan Area Agency on Aging, and we are operating under the umbrella of Metropolitan Area Agency on Aging through the Senior LinkAge Line. The mission focus with Metropolitan Area Agency on Aging, it is to assist individuals to age successfully and develop the capacity to communities to care for an aging population. So basically assisting those that do want to remain independent for as long as possible, and even providing resources for transitioning if that's also what they would like to do. Here is a broad overview of how the funding sources work. So once the funding is provided to Metropolitan Area Agency on Aging, it tunnels down into help and information and education, which is part of the Senior LinkAge Line. And then there's the community partners, and they help with providing resources and funding for different programs such as Meals on Wheels, other community programs out there, different types of funding for helping people stay in the community. Depending on what those are, it could be healthy aging, even transportation grants are provided. Just a lot of different resources, just depending on that location. But they do provide a lot of different resources into the community as well. And then comes the advocacy part as well. And who does that would be our executive director, Dawn Simonson. So she speaks on behalf of the Metropolitan Area Agency on Aging. And I'm also going to reference that as MAAA as well, because it can be a tongue twister. But she's the one that advocates quite a bit, communicating with a lot of legislation and advocating for different resources for the aging populations in the community. So she's the one that really stays on top of those things as well. And then as you can see here, like I was mentioning earlier, with the livable communities. So it just depends on what type of grants that they're applying for, but they provide funding for lots of different organizations. Everyone that is on the phone lines for the Senior LinkAge Line, we are all designated state health insurance assistant for programs. So we are able to, we all have received that training where we are authorized to talk about your Medicare resources and talk about different insurance plans. We are a nonprofit, so we do not sell, and we're not able to use a bias. We're just able to provide those resources and answer those questions that you may have. So we are all authorized to do that, and we have to all go through an extensive training before we are able to do so. And so if you do decide to give us a call, that will be the number to call, and our normal business hours are Monday through Friday, 8 a.m. to 4:30 p.m. Here are the goals of the Senior LinkAge Line. Promote choice and independence. Everyone wants to have an option. Everyone wants to be able to have a decision on what they do or where they go or how to get the help, and not always told what's best for them. So that's something that we really strive to empower people with, is just giving them that option to know that the choice can be theirs, and how we can help them achieve that goal. And how we do that is we try to connect them with the resources that they feel are the best for them, and then providing as much accurate, helpful information as possible. And we obtain that just basically by listening to what their needs are, listening to what could be best for them, and that's not our decision to make. Once they're telling us what they need, then we try to zone in on that. And what we research, We go through all type of different resources. It really depends on a person. Sometimes a person can call in or even walk into our agency and talk with someone, and they may know exactly what they want, where they're going, and that can take a meeting or a phone call of 5 minutes, but it can also range to 2-3 hours. It just depends, and include additional follow-up. So when we say accurate, helpful information, is really based upon their feedback, saying what they feel that they're getting from us. And service and benefit options, just letting them know what's in their community, letting them know what's going on with them that can help the best, depending on what their needs are. But that's what we do. We try to craft something specifically for them. So when someone is calling in, this is the normal greeting that you're going to hear. Someone's introduced, thanking for giving a call, introducing who they are, asking how they may help. Before they can go too far, we also got to make sure to let them know about private health information and get their permission before we go any further with anything. But you do not have to share any of your information for us to assist you, but there's certain things that may require that. And before we go any further, we just have to let them know and get their permission to proceed. These are some of the options that are available to help. As you can see here, we have Medicare and other health options. We have government service-related questions, nutrition, transportation, healthy aging programs, caregiver support, and we'll get into that too, senior housing, home repair. Everyone's needs look different. Everyone knows what is best for them, and sometimes if they don't, then I'll also talk about that too a little later, where we get a little deeper with that, finding out what's going on. We have some people that'll call in and just ask for help with an application, and we can pull up those applications many times, like say from county programs, Medicare assistant programs, so we can look at different applications and we can help explain what some of those questions can mean. And then there can be times where we can even help them advocate. We may not have access to know what's going on with someone's case or something of that nature, but we can find out their status, or say someone is feeling that they're not getting through, so we'll try to be that tool for them to help advocate for someone, to give them a call or to follow up to know what's going on. And then when it comes to, for example, transportation, that is a big one. And those resources, I will also say it depends on where you live. The metro area tends to have more resources for transportation than the outskirts, but again, it just depends. So a lot of times we'll talk to people, especially with weather like this, where they're wanting to know if there are other options available to them to get to appointments, to get to the store, to get some additional help. So we'll try to look and find out what's serving their area. And then we'll see if there's something available that's affordable for them. In certain locations, they may qualify for something that is free. It just depends on where they live. But when we are crafting something for them, we do our best to see if those options are available first. We always try to see if there's available resources for free or sliding scale fee before we go into anything else. Sometimes there are resources, sometimes there's not, but that's one of our first things to do, is just to see if there's anything affordable, reasonable, within their range. We have people call in for home repair. Someone can call in and say that their water heater busted and they need a repairman, or they want to know if there's any resources out there that can help pay for the service. Sometimes there can be. So we'll take that information as well, and we will look and see what's out there for that, because we search into our database and it'll tell us what is available to them. And it doesn't give us like the price if there is like a service such as that, but we can find out if there are resources such as something to help pay or provide funding for it. Legal resources as well. We're not authorized to give legal advice, but we definitely can look and see if there are resources out there tailored to what they're looking for, just so they can give them a call. And we also will warm transfer them if that's something that they feel comfortable with, to make sure that this is the correct place for them, to make sure that that's the right telephone numbers. Although we do work hard to make sure that our information is updated as much as possible, sometimes things can change. So some individuals may want us to call with them, and we definitely will. Make sure that that phone number is valid, or even just making sure that this is the phone number for them. Then we have senior housing. Senior housing is something that I talk about quite a bit. when I was on the phones with a lot of consumers is trying to find housing that's tailored to their needs. Housing comes in so many different sizes for everyone. There's some out there that are looking for housing because they're homeless. So we're trying to see if there's anything out there for them and how to connect them with the resources that they have to have. Then there's those that are just transitioning from their own home into maybe an independent housing or senior housing, assisted living. We'll look at resources for that, or they're looking for funding. It just depends, but housing can definitely be a very broad scope, and I can talk a little bit about that too. But we talk to them about all these different things, chore, homemaking services, all those things. This is a database called minnesotahelp.info, and to kind of answer your question, we are connected to this database. Ours just look a little different from our side, but what we can do is filter it out. And as you can see here, there are families, government, homeless, refugees, seniors. You can see that the list goes on and on. So it's not just for one person or another. So even if they have things for like youth, as you can see in here. So all you do is type in what you're looking for in that top search bar, and you can give them, when they say where, you can enter in city, zip code, and then it'll do a search in Minnesota to see if there are any resources out there specifically designed for them. So that's something that a lot of consumers can navigate, and if they prefer, they could give us a call. And our database is connected to this one. Our screens, of course, look different, and it's connected with a more private database, but we can craft and tailor a list of resources that we can either verbally provide, or we can both verbally provide and mail out. And it could be like a PDF printout where it's giving you the names, the telephone numbers, the services that they're providing, the location, all that information can be on the file that we send out. Otherwise, people go here as well. And if someone is, say, new to going to minnesotahelp.info, we can even help walk them through that. So, but this is a definite valuable resource, and that's something that we tap into to connect people with the different resources out there. And a lot of the times, people are unsure on what long-term care options counseling is. Everyone has a different view on what long-term care option counseling is. And basically, to sum it up, it's just the opportunity for consumers of any age who are looking for the best ways to age well and live well in a community of their choice. Not of what someone else feels is best for them, but what they feel is best for them. And as you can see here, that in a survey done by AARP, it was found that 87% of people 65 and older and 71% of people 50 to 64, they do want to stay at home and age well in their communities and just want to know how to successfully do so. These are the costs that we pulled up from the Genworth Cost of Care survey just of last year. As you can see here, just going through it, you have the home health care. Then you have homemaker services. Now, annually, you can see that the cost is $66,352. But if you were to kind of just section that off into hourly, $29 an hour can be beneficial for someone that may just need some help with in-home services, helping with chore services, helping with laundry, helping with cooking. So it could be very cost effective for some individuals that are not needing tons of resources. But again, then some people we talk to, they may say they don't get paid the $29 an hour. That cost can look different depending on if you're going through an agency. If someone is going through an agency to get those services, then they're going to take a cut of that $29, and a person that is doing the services, then they may see about $10, $11, $12 an hour from that cost of who they're helping, like a PCA services and things such as those. Then when you go into the home health aid, and home health aid is those that are licensed to do more, where they're able to like medications and things such as those. And you can see that the cost is not that different. it's a little bit different. This one is $69,784 and $30.50 an hour. But those are, again, is based on a 44 hours per week. Everyone that gets these type of services, they don't need all those hours. Some people might need them. I will say it just depends on them. But these are the types of things that we operate from as we're trying to help someone figure out what's best for them when they're looking at resources and options. Then you have adult daycare. I talked to many over the years when it came to adult daycare services or just needing some help. Say it's a caregiver. You're caring for your loved one. You're caring for your spouse. You're caring for a friend. And say you are working or you need some respite services or you need some time where you can run errands. There's times where they'll have them in an adult daycare to still keep them socially active or involved and let them have a social life of their own. So we'll look up resources to see if there's any adult daycares in the area where, and you can see what the cost looks like here is annually is $21,580 or is $83 a day. There are even some adult daycares that can help with things like showering the person or helping with cutting their toenails. It just depends on that location, but the needs stretch. But we will definitely talk with people about all these different things because some feel it's still cheaper doing this than transitioning them into assisted living. Assisted living looks different for many people. Assisted living is when you're bringing services in or when you're paying for additional housing with services. Those, as you can see here, this is an annual cost of $53,100 annually, $4,425 a month. And what I will add to that is that cost fluctuates depending on if someone needs help. It depends on the location that they're moving to, and it depends on the services that they're accessing. There's been different assisted livings that I have personally spoken with and talked with, and the cost can be between $3,000 and $4,000, just including a few things. So when someone calls in, we are not there to tell someone to move or to not move. We just try to help people walk in with the knowledge of knowing what they want. Because there's different assisted livings out there, and there are some that are more expensive, and there are some that are more cost effective. So it's just our job to make sure that as they're making those choices, they're aware of the questions to ask when they're going to one of those locations. And like even with caregivers just trying to sift through and make a plan, we give them all this information. And again, it's not biased, it's just giving you all the resources so you can feel you're empowered with the tools you need to make a good choice for you or your loved ones. Then there's situations where they may have to go into a nursing home care facility. And as you can see here, just for a semi-private room, the cost can be annually over $100,000, $101,897, $279 a day. And again, that cost can fluctuate depending on what those needs are. But having resources such as this is a good driving source when we're talking with someone on the telephone about long-term care options counseling. So when they are setting up plans or setting up a goal, we even talk to caregivers that are trying to figure out research to bring back to the family for a family meeting or to make a plan. So we'll go through all those things for them, and some telephone conversations they could take from an hour to 2 hours just looking at resources. And if they're still not sure, there's other materials that we could send out that they can look through on their own and still have access to everything out there. So when someone is moving or staying at home, you're feeling content knowing that you had access to all these different options, and it's you that's making a choice instead of feeling you're pushed or pressured into going with one place over another. Because sometimes it could be an assisted living that you're liking the area or you're liking the way it looks or you're feeling that you're getting good service, but sometimes that's not enough because the needs can change, and that's when the conversation can get a little bit more deeper. So again, it's about the options. It's about us giving them a talking about what's out there, what the resources are. So as I was just showing you on the other slide about the cost, that's a part of providing those variety of options for home and community-based supports. Because there's times where I had talked to someone and I would ask them, so what's the reason for the move? And they would just simply say, because they're old. So when I talk with someone and that's the answer that they give, I don't try to talk anyone out of that, but I do want to provide them with something where they don't have to feel that just because you're a certain age, it's time to go, or it's time to leave, or it's time for different things to be done. So that's what we do. We let them just give them hope and let them know you don't have to do certain things if you don't want to. So let's look at what's out there for you. So if you do decide after everything is said and done, you still want to move, then we're here to help you find a good place to move or provide you with the resources to do so. And as you see, like with the question to ask for touring, there's a booklet that we can even send out where there's a list of questions that you can ask. That you can kind of help prepare yourself, where you're not just looking at all these different things, but you're actually able to have some helpful information that you're walking away with, that you're feeling like this is a good place, or maybe no, it's not so good, or maybe the cost is a little bit too much. Because I've even talked to some individuals that they like the location they're moving to, but their needs changed. And once their needs changed, then the cost changed. And once the cost changed, they could no longer afford it within the budget that they were expecting to have. When someone does call in, these are some of the top questions that are asked. How can I live well in my community? What resources and services are available to me? What are my options for housing? And what questions should I ask when I tour? I talk to people that may just need a little bit of help around the house, need some help with yard work, need companionship, someone to help them go to the grocery store. So we try to let them know that just because you need a little bit of help, it does not mean that you have to go. And if you do want to go into a housing with services setting, or just say even an independent living, then let's see if those locations got access to the resources that you're needing, and is the access reasonably cost for you. And the resources and services, again, is tailored to what their needs are. And we use the Minnesota Help to guide us with that. But there's also some resources that we can dig into just by consulting with one another, or just through experience that we've had working with different locations. And we can say, oh, there's a program for this, there's a program for that. So we can try to give them and really craft something together to give them something good to go off of. And with the options for housing and what questions should I ask, again, that's the one that we always talk about. And if they feel like they need more, there's a list again that we could send out to help them prepare. So topics that we address, like the medication setup, as we were looking at the cost before, that can look different for everyone. Some people are fine with just saying, like, I have an automatic medic service set up where the medication is timed and it delivers the meds so they don't forget. And then some people need something a little bit more. Then you have like the personal care, the bathing, housekeeping. Foot care is definitely a common one as well. Personally, emergency response systems, definitely a common call where they're looking to find out what's out there. Some people will ask us what we recommend, but we cannot provide you with what we recommend because, again, we're not profit, so we have to keep it neutral. But we try to give them as many resources as possible, so as they're looking through and calling those places, we can find out what's available to them. And then at this time of year, we have a lot of seasonal calls. Snow, we have the problem with the snow right now, and then it depends on the season. There's times where they want some other yard work done. They want their lawns mowed, leaves raked, or some things done to the outside of their homes. So we look and see if there's any type of resources in their neighborhood for that. So we'll talk about those things. And then there's some people that like even just need a check-in. We can look into resources for someone to visit them, sit with them, keep them some company, or just give them a call to make sure that they're okay. Or if even medication reminders, there's all type of things that we can look into to see how we can help them best. even if that again is staying in a home or moving. I'm going to bring back up when I talk with someone and say, why are you moving? And they'll say, because I'm old. I know that with us, one of our missions is to get a little bit more information, because even if you feel like, you're old and it's time to go, that does not eliminate what type of needs you have. It doesn't eliminate the services. It doesn't eliminate the resources. So what we do is we do the Live Well at Home. We do a rapid screen. This is something that is also accessible to you online as well, but this is what we use too when someone calls in. And the questions are pretty conversation based. When we're talking with someone, a lot of times just going through just the motions of talking with someone and where they're at in their lives, a lot of these questions are answered, and we use this as a way of determining how to help them best get the resources they need or the phone numbers that they want. And a lot of times this can open up doors for them to even say, you know what, maybe I do need to think about this type of service. Is this being offered? How much this will be costing me? And this is something that we do with the consumer or with the caregiver. We'll ask these type of questions, and it'll just open up a whole other area of a conversation topic to find out what type of help that they can get. Based on the results of that at-home risk assessment, it can direct us into talking about Minnesota choices. Because a lot of times I've talked to people in the past, and people call in now, where they really are not sure what their needs are yet. They're not sure how to prepare, not sure how to plan, what resources are available. So what we do is, if they need more help or say they want to sit down with someone, then we will direct them with Minnesota Choices. And Minnesota Choices is offered for free in every county that someone lives in. There's a phone number that we can provide for that county, and you can schedule a time to come out, and they will do a long-term care assessment with you. That can be where they go over all your needs and talk about what that looks like to help form a roadmap on what type of services are going to be good for you to help you either thrive in a community, or for you to take that information with you as you're doing a search for moving into an assisted living or something of that nature. Minnesota Choices, they do have the assessment tools also for if someone is applying for a waiver. And a waiver is something, there's different waivers. For those that are 65 and older, there's a waiver called the elderly waiver that a lot of individuals apply for when their funds have dropped down. And an elderly waiver is a waiver that you can use in an assisted living, or you can use at home. It's something that'll help pay for services only. And that's another thing that when we're talking about housing, we mention that too. So as you're doing a search for your housing and you're trying to plan, you're trying to prepare, it is always good to think about what your future can look like, say if you ever do need help paying, because some places don't take a waiver and you may have to move to another location. And a lot of people don't want to move, so they want to find somewhere where there is that just in case step in place where, say, their money is fine and they're doing good, they don't need any help, but say 2-3 years down the line the needs have changed, then they may need to apply for the waiver. And say they're living somewhere and they accept the waiver. So some places have where you have to do private pay for about 1 to 3 years before they take the waiver. And then you have some locations that will take the waiver right away. So it's just good to have that in the top of your brain when you're researching different places, so you can know just in case. And then you have those that have the waiver and they're looking for locations that take the waiver, and that's another piece of the housing that we look into as well. So everyone's situation looks different. And then there's a waiver for those that are 65 and older as well, called the alternative care waiver. That waiver looks different. It helps pay for services, but it is designed for people that want to stay at home. It's designed for those that want to stay at home and just need some help in the home. It's not a waiver that can be used in an assisted living. The elderly waiver, you can use it at home and you can use it at an assisted living. But the alternative care waiver is strictly for individuals that want to stay at home. Plus, there's more wiggle room with assets with the alternative care waiver than there is with the elderly waiver. To qualify for the elderly waiver, they also have to qualify for medical assistance, and that's where you bring in the $3,000 assets. If someone were to qualify for the alternative care waiver, they have a higher asset guideline, and that is factored in with their income. You have a higher income range and a higher asset with the alternative care waiver, which is also can be a benefit to many that don't want to move yet, and they're just needing some help in the home. So Minnesota Choices is a place that would assess to see if people qualify for those waivers. And if it's someone that is under 65 years old, there's a waiver out there called a caddy waiver that they can also get assessed for. There's other waivers as well. I don't have all the listings of those, but just giving you an idea, when you're applying for any of those type of resources, Minnesota Choice, they can help with finding out if you qualify for the waiver, helping to discuss the question that you had about housing. What if you want to sign your house over to your children? What's the look back time frame? What's the qualifications for that? They can talk about those things. They can comb through your assets and tell you what things look like if you do want to apply for any type of assistance. Minnesota Choices is definitely the way to go and try to help you put together a plan. So, and it doesn't cost anything, it's free. And if you need the phone number, you can easily give Senior LinkAge Line a call, and they'll look up a phone number for your county in your area, and you can give them a call and set up an appointment, and they will come out and meet you and talk exactly about the situation that you're even having with the children in the house. That's one of the things too. Even if you're not ready to apply for services, you can still call them and they'll come talk with you. So again, these are some of the topics that I'm talking about now. When calling in for long-term care options counseling, we look at the paper. We help you talk about the paperwork. We talk about healthcare directives, power of attorneys. We can even send those things out to you. Whenever I was on the phone with someone, I was just naturally asking them those questions because a lot of people don't have them. When I will give a personal example of saying my mom, she had to have a major surgery done, and there were some things that she didn't have in order. So by me being the only caregiver for her, we had to do the power of attorney, and we had to do the healthcare directive to make sure that everything that she felt was in place was being done before anything else. And that helped her feel empowered. She felt very prepared. She felt that she was on the same communication page with her doctors, her surgeons, anyone else that was involved in her care. She just felt more prepared. Then we talk about like the paying for the care. As you say, I mentioned the county assistance programs, savings and income, veterans benefits. There's programs out there for those who have been veterans. So we try to zone in on everybody's needs different. And right now, there's energy assistance programs that people can qualify for. And sometimes we get a lot more of those calls around this time of year when it's cold and they're trying to find out how to pay for certain bills. We'll try to find out there's resources for that too. Then the Lifeline phone program, very common one. Then with the housing, everyone's situation looks different. There's people out there that want to stay independent. They just want to downsize. So we'll talk about downsizing and resources needed to downsize. And if there's any resources out there to help pay for that, moving services, things such as those, just to help them prepare for what steps might be coming their way. We try to provide all-in-one services as much as possible because a lot of individuals that have questions about long-term care, they of course also have questions about their Medicare benefits, if that's something that they're collecting on. There have been instances where someone questions if their Medicare benefits cover services in the home. That's something that is projected to change. We don't have specifics on that yet, so we can't really guarantee it, but that's definitely something being looked into to help pay for some in-home services through Medicare, but currently not yet. But we do try to help comb through what their benefits look like. And do you know how many Medicare plans were available that we talked about in Minnesota just this year alone. 152. Everyone's situation did look a little bit different. This last year, there was some major changes that's happened with people that were on Medicare cost plans. There was people's cost plans that were ending, changing locations, all kind of things were happening. And not only that, but open enrollment also brings in quite a few individuals that are wanting to either change their plan, see if that plan is still working for them, seeing if that plan is still cost effective. Are their doctors still in that network? Are their medications still covered? Even those that are on county programs, they call into us as well to find out about the drug plans connected with these plans, to find out and if the places that they want to go to is in that network. So we have had a lot of individuals call in. With the cost plans, it impacted over 300,000 Minnesota residents. So we received quite a few phone calls. But otherwise, we also talked about everything else too. Many questions with Medicare. Medicare is constantly changing. Medicare Part C it is an Advantage plan. The Advantage plan, and it could be an HMO plan, but let's just say the Advantage plans, those are the plans that come with health and drug coverage connected. So that's a Part C plan. And I will encourage, anytime you see free, to do a little bit more digging into that, even if that means to call us or to call another representative. We help with looking to see what plans are available, but we never tell someone which plan to go with. We don't collect any income off of a plan someone goes with, while there are some locations that do. And when there's a plan that says $0, you want to make sure to find out if is there a high out-of-pocket cost, because sometimes if you see zero, the out-of-pocket cost can be pretty big. And then there are also programs, say if you're income qualified, where you can qualify for an Advantage plan at a lower cost, but it's because it's connected with another program. So there's differences with that, because there was a presentation that we had did a couple of months ago where someone had been told about the $0 Advantage plan. The out-of-pocket cost that they had to pay before anything was covered was $10,000. So it's just good to kind of comb through that to make sure, is this really the plan for you, and is it covering what you need? Because sometimes some people may feel like it's a good plan for them because they just want to have something, but then there are those that get the plan and it's not what they thought it would be. So when we are talking with someone, we are letting them know this is what's listed to be covered. And we also encourage people to contact those healthcare providers to see if there's been anything that's changed. So we try to encourage those type of conversations before going into a plan, because once you do get into an Advantage plan, you're pretty much going to be locked into it for a certain period of time, unless there's certain acceptable circumstances, or if they're in that period where you can disenroll. But if you bypass that period where you can disenroll or change a plan, or you don't qualify for those different circumstances, then the plan is going to be yours for the year. And a lot can happen in a year's time. When we do talk with someone, all the information is kept confidential, and this leads into what we talk about when you first call in. We have to get your permission. Before we go any further into any personal health information, we have to get permission first because it's private. Before sharing your Medicare information, before this, we have to let you know what we document, and it's private, protected health information, because Medicare is definitely something that gives people access to a lot of your private information that you definitely don't want just in anyone's hands. And we do, again, because we are a nonprofit, our information is very objective. And there's a lot of times where we'll talk with someone and say that they really are not sure yet what plan is for them. We can talk about the plans, and we can also send you out printouts, details for those different plans, a breakdown of what the tiers for the drug coverage can be. All those things we can send out to you so you can feel comfortable and not feel pressured into deciding. Because sometimes I have talked with individuals myself where they felt pushed or pressured to make a sudden decision on a plan. We don't do that. We just want to make sure that you're feeling comfortable, because medication lists can change, doctors can change, you can move. So we want to make sure that you're having all the resources that you got. So as you make a decision on that plan for you, you're feeling confident, you're feeling comfortable, you're not feeling any type of pressure, and you know that this is the thing that is best for you. These are some of the topics that are definitely discussed, like you mentioned, the Part C, and that's also called the secondary plan. And the secondary plan is where you have your original Medicare that covers basically 80%, and you pay 20%, but then there's a lot of consumers that may want some extra coverage. And that's where you move into those different types of plans. Or you got some that say they have their original Medicare, they want to keep their regular Medicare, now they just want to add on drug coverage. Then that's when we talk about the Part D plans. And then there are individuals that do want some extra coverage, like the dental, vision, hearing, those types of things. That's when we look at those different secondary plans as well to see if any of those fit for you. Then there is also another plan called the Medigap Supplemental Plan. And that's something that when someone calls in, one of our representatives can see if the consumer qualifies and provide them with the resources to see if that's a direction that they can go if they want to. Then there's some people that'll call in and they don't agree with their billing. They're having some problems, they're having some questions, they want to appeal something, or they want to do a complaint, or they feel even if there's Medicare fraud involved. Those are things that people can call into Senior LinkAge Line for and get some help and get some guidance on how to plan to proceed with that too. And then we have like the medical assistance. Individuals can call in and want to know if there's anything out there that can, if they qualify for medical assistance, or are there anything out there that can even help them pay for their original Medicare costs. Many times there's programs that can be offered that can help pay for all or some of that original Medicare costs, or even seeing if they qualify to get help paying for their prescriptions or for their drug plans. So these are just some of the topics that are being assessed when someone calls in, just to make sure that if you do qualify, you know that we're talking about it with you, and you're not just saying, I didn't know about this, I didn't know about that. So we'll with the permission of who calls in, but we will see if you qualify for anything that can help to alleviate some of that cost strain if needed. So those are just some of the things that we do address when someone's calling in with us. And here are the ways to find the resources, contacting us over the phone, on the website medicare.gov and minnesotahelp.info. And we have many health insurance counseling sites if you would like to talk with someone in person to get a good idea about the plans that are out there for you. Because we talked a lot of times, people will say, I want to speak with someone in person. And we'll see if there's any locations in their area. And even if there is not, we'll tell them what locations are available. Some are willing to travel. And then we also have walk-ins at our location, where someone can come into our agency and they can talk with someone there. Whoever's available will come sit down with you and go over health insurance counseling or the long-term care options resources as well. So you can also come in for that too. So we are available multiple ways. And then we have the healthcare fraud. That's something, again, when someone calls in for Medicare. And with the healthcare fraud, that is something, as you can see, it's costing many billions of dollars every year. There are different ways to detect it, so we try to empower people to know how to look at that Medicare summary notice. That notice where you are, it's the thing that where it says this is not a bill, but it's showing you what type of charges and what type of costs are for the visits that you've had with a doctor. There's times where some people have called into us and they don't agree with what they're being charged, or they're saying they didn't receive this type of service. So that's something that we will address. And we definitely encourage everyone to guard that Medicare card. I remember walking into my mom's apartment building. She did not even realize it. She dropped her Medicare card, and it was just sitting down there. I was so glad nobody did anything, because she had contacted Social Security to request a new card, and I walked in the door with her card in my hand. And now just imagine if someone else got access to that card. Dangerous, very dangerous. So it's just good to just kind of take a couple of precautions just to protect yourself. Medicare.gov, this is definitely the most trusted resource used when it comes to looking up Medicare information, when it comes to enrolling in plans, looking at your benefits, seeing what type of services are provided, what type of doctors, plans, hospitals. We have been all over this website when we're on the phone with someone, and there's individuals that we talk with that we help guide them through so they can learn about it and even creating themselves their own accounts. So we will help try to empower anyone that wants to know more on how to go about it. You can look at claims and appeals, you can look at the forms, your resources, look up your Medicare costs. This is a definite resource to use, and is reliable resource to find out anything about your Medicare information available to you. This is the only website that we as Senior LinkAge Line utilize when it comes to navigating any of the Medicare plans and resources available. And you can also register here and get access to your Medicare summary notice as well. So this is a definite good tool to use that we use, and we can also help anyone else if they need help guiding, that will help them learn it too. Then we talk about caregivers. I mentioned that I am a caregiver as well. Caregivers come in different shapes and forms, and those can be your loved ones, your neighbors. Sometimes there's co-workers looking out for one another, a good friend. So we talk to a variety of people when it comes to who is a caregiver. A lot of times there's people that don't feel like they are a caregiver because they're just doing what comes naturally, taking care of their family or friends. When my grandparents were living, they had a neighborhood that was helping them with the resources. So they would even help shovel, fix them food, help advocate for a handicapped parking spot right in front of their home, checking on them when the children wasn't able to do anything. Those are the caregivers. Even if you're just calling in saying, I just want to help them with an application, you're still a caregiver. These are some of the common tasks: transportation, taking them to the doctors, to the store, medical assistance, making decisions for any of their billing, shopping, cleaning, companionship. All these are just some ways to identify who a caregiver is. And it doesn't always come in just one shape or form. It's when you're just caring for when you're taking care of someone, helping them thrive the best way that they can, you are a caregiver. And as you can see here, many of us are caregivers. This is an estimate. 34.2 million adults are estimated. And this is back in 2015. And then you can see here, 80% were caring for at least one person and 15% caring for two. And an estimated of 37 billion hours of care has been provided back in 2015. And that definitely has expanded. If we're looking at it from an economic standpoint, the cost of being a caregiver is right in line with Walmart and the cost for Medicaid or spending on health care. You can see it up there. So being a caregiver is still saving a lot of dollars that we wouldn't be able to accommodate if caregivers were not available. You can see the time commitment to being a caregiver. It can be pretty large. The financial commitment, the work commitment, the emotional commitment. And these are things that when someone calls into the Senior LinkAge Line, we try to address as much as possible, asking them, how are you doing? Asking, do you have resources? Because we can look up caregiver resources for them as well. A lot of times, as many may not know, but caregivers sometimes don't outlive the care receiver because they tend to forget about themselves because they're so busy devoting so much to their loved ones. This looks different for everyone. These are the help resources that we talk about for the caregivers. So support groups, respite. Respite can look in different forms like the adult daycares. Then there's assisted livings that can have respite care services. Then they can have in-home respite where you're bringing someone into the home. Then there's a training and education on how to proceed with being a caregiver, and then having a coach or a consultant. I have talked to caregivers where I have really tried to work with them to get them the resources they need because they were telling us that they were pretty burnt out. So we were trying to get them the help that they needed or connect them with who they needed to talk to make sure to get them back in the groove of things, to make sure that they're feeling okay. Well, thank you guys for coming out, and enjoy your weekend. Thank you. Thank you.